So a breast lift is for someone who has adequate breast volume and just needs to reshape and lift things. A reduction accomplishes those goals with the addition of removing some volume. Usually with a breast reduction, it can be for two reasons. One, it can be someone who is just uncomfortable with the size of their breast. Then the second factor that comes in is that many patients also have symptoms from the large breast. They have back pain, neck pain, shoulder pain, and they're looking for a way to feel better about how they look and alleviate those symptoms. So a breast reduction, it can be a wonderful surgery to address both of those issues. With a breast lift, it's usually there's not symptoms involved. It's just a matter of needing to reshape what you have. Most of the time it would be someone who's satisfied with the breast volume that they have and really just wants to reshape things and create a more aesthetic shape to the breast. So with a breast lift and a breast reduction, they're very similar in the types of surgical scar that is placed and some of the technique that goes on. Obviously with a breast reduction, you're removing breast volume, but in both surgeries, you're lifting and reshaping. With a breast lift, typically there's some scar on the breast, and they can be placed in a variety of locations, but almost every scar is going to involve a scar that goes around the nipple. Any scar that you put on the breast or any cuts that you make on the breast are always going to be associated with at least a risk of some numbness. Everyone can be a little bit different. Sometimes it's a temporary thing, if at all, but there's always a chance it could be permanent. So anytime you're putting permanent scars, and all scars are permanent, on the breast, I think there is a hesitancy with a younger person to try to avoid it, or at least make sure that it's a very educated and well thought out decision. So most of the time a scar is going to be around the nipple. A lot of times it's a vertical incision from the nipple down to the crease underneath, and then oftentimes there can be one that goes along the crease underneath as well. So a lot of times it's described as either a lollipop or an anchor type incision, and it takes a while for scars to blend. So there's definitely a trade-off. And as we were talking before, I think we tend to shy away from putting a scar on the breast unless it's absolutely necessary. But unfortunately, sometimes it really is to give the shape that you want or you need, or you're going to be happy with long term. Yeah, the procedure takes a few hours. You go home the same day. Most people take minimal pain medication and usually within a matter of days feel well enough that they can drive and do light activities. Really, the recovery comes in those few weeks after surgery where you have to be pretty careful with your arm activities. So, as long as it's light work or desk work, most people can go back pretty quickly. But if somebody has an active job where they use their arms a lot, it can take a while till you can go back to those activities. I would say 4 to 6 weeks. So you definitely have to be careful. It's a lot of incision and just takes a while for the body to heal that. So you have to be careful with your arm activities. You have to do what we need to help the incisions heal. Maybe. So, and that's about as good as I can ever give anybody. So anytime you make cuts in the breast parenchyma, you are always going to affect some of the milk ducts. And so whether someone can breastfeed is it's always a maybe. You might be able to, but certainly it's not anything I could ever guarantee. Certainly any surgery on the breast doesn't make it easier. There are definitely people who can do it after, but I don't think anyone could ever guarantee that absolutely you would be able to afterwards.